And we are back with our good news story of the day. On April 23rd, ER nurse Deb Buonopane was released from Brigham and Women's Hospital in Boston after a difficult battle with COVID-19. And look at this video of an incredible send-off. She is with us now. It's so good to see you in this frame right now with that background and a smile on your face. Talk about the initial phase of this. You were working with COVID-19 patients and then you got sick.
Yes, I got sick. It started around April 7th when I had a runny nose during my 12-hour shift at work. And I lost my sense of taste and smell. I got home that night. I had terrible chills, woke up in the morning, had a fever of 102. I had stabbing pain in my ankle and knee joints, and I was asked to go get tested for COVID-19, and I came up positive.
And now, and so how, like, right away, I'm assuming if you're working with COVID patients, right? So right away, as soon as you developed the runny nose, did you start thinking in the back of your head, uh-oh?
No.
Like, no, it didn't occur.
Really?
Oh, no kidding. You just you didn't even think about it. You put it out. You were too busy.
I was busy.
I mean, you talk about a real fighter here. You're also a cancer survivor as well?
Yes, I did have cancer in 2003. My son was just turning 1. My daughter was 9. I ended up being a single mom, and I had chemo, a double mastectomy, and I was honorably discharged from the United States Navy as a lieutenant in the Nurse Corps.
Oh my goodness. You know,
it was a hard time.
It really, I mean, the amount of strength that you must have that comes from somewhere deep within, right? And you're doing such extraordinary work. You're on the front lines of this thing, this COVID virus,
Yes.
and then you come down with it. Did you have to go on a ventilator or anything like that?
Well, being a nurse is hard because you know everything, and I told them I didn't want to be on a ventilator, so I know I had COVID pneumonia. My oxygenation was low. So every day I try to build my strength to get out of the bed to go to a chair. And I used to do some deep breathing exercises because I knew I was a candidate for the remdesivir trial.
As you sit there today, are you anxious to go back to work? Are you concerned about going back to work? How do you feel about that?
Well, right now I'm a little fatigued, so my job wants me to make sure that I get stronger before I go back to my job. And I've been an emergency room nurse at Brigham Women's for 31 years, and I have a lot of good friends there. And it's an honor and a rewarding career to me to be a nurse.
Well, we are so grateful for what you and all of your colleagues do for all of us every day, and especially in this time. And take care of yourself. Get some rest. And take
your time. You earned it. You earned the time to recover. So recover and rest up and stay safe.
Thank you, Kelly. Thank you, Ryan.